Welcome to the deep dive. Today, we're jumping into something really important. It's where technology meets our health. Artificial intelligence in healthcare.
Exactly. AI holds so much promise. It's really exciting.
But like any powerful new tool, there's always that other side, isn't there? The risks, the things we need to think about really carefully.
Absolutely. And that other side is what we're digging into today. We're looking at a huge piece of research, a scoping review and evidence gap analysis all about clinical AI fairness.
Okay, clinical AI fairness. This came out of a partnership with Seoul National University Bundang Hospital.
That's right. It looks at all the existing research and points out some frankly surprising things about how AI bias is already playing out in healthcare equity.
So our goal here is to unpack that, understand what it means for actually delivering fair healthcare.
Precisely. For everyone.
Okay, let's start there then. When we talk about AI fairness and AI biases in healthcare, what do we actually mean? Lay it out for us.
Sure. So AI fairness is basically twofold. It's
Yeah.
about spotting and reducing those systematic biases in AI systems, but it's also about using AI proactively to make things more equitable.
And the bias part.
Right, AI bias, that's like a built-in slant, a systemic tendency that ends up disadvantaging certain groups, maybe based on gender or race, ethnicity, things like that.
You mentioned healthcare is high stakes. I think that's obvious, but can you spell out why bias is so dangerous here? It's not just a coding error, is it?
Oh, not at all. We're talking about health equity. The basic idea that everyone should have a fair shot at being healthy.
Right.
If we don't bake fairness into these AI systems from the start, they could actually make existing health inequalities worse. That's the real danger.
And fairness isn't just one simple thing, right? Especially not in medicine. Does it change depending on the situation?
Definitely. It's very context specific. Take dermatology, for example. A lot of AI models are trained mostly on images of lighter skin. So predictably, they're often less accurate at diagnosing conditions on darker skin. That's a direct risk to patients.
A really clear example.
Any others?
Yeah. Liver transplantation, there's this algorithm, the MELOD score. It uses a measure called creatinine to assess kidney function,
Right.
but it uses the same standard for men and women, even though women often have naturally lower creatinine because of, say, less muscle mass on average.
So it might underestimate how sick a woman actually is.
Exactly,
Mhm.
which could potentially lower her priority for getting a transplant. It's a fairness issue baked right into the formula.
Wow. Those examples really hit home. So this big review, looking at nearly 500 papers,
hmm
what did it find overall? Any big surprises or gaps?
Yeah, the headline finding was pretty stark. There's this huge gap between all the academic talk about AI fairness techniques and what's actually being used in real clinics.
No disconnect.
A massive one. And surprisingly, research on AI fairness is just missing in action in lots of medical fields. Anesthesiology, dentistry, immunology, hematology. Very little there. Even in fields where AI is used more, like cancer or cardiology.
Even there, the review called the attention paid to fairness insufficient. So yeah, it's a widespread problem.
And what kind of fairness issues were people looking at? Was it broad or?
Actually, quite narrow. Most studies, the vast majority, focused on just a few things: ethnicity, race, gender or sex, and age.
Okay, the common demographic factors.
Right, but other really crucial factors like skin tone, specific health conditions someone might have, even something like how experienced the doctor using the AI is. Those are often overlooked.
Interesting. And you mentioned different types of fairness, group fairness versus individual.
Yeah, that was another key finding. Almost all studies, over 93%, looked at group fairness. That means checking if the AI performs equally well, on average, across different groups like men versus women or different racial groups.
Which sounds important, but what's the downside?
The downside is it neglects individual fairness. Only about 4% of studies looked at that.
And individual fairness is.
It's about ensuring that similar individuals get treated similarly by the AI, regardless of what group they belong to. It's absolutely critical if we want AI to help with personalized precision medicine.
Treating the individual, not just the group average.
Exactly. And one more thing, getting doctors involved. Only a handful of studies, 33 to be exact, actually brought healthcare professionals into the process early on, beyond just having them test the final product.
So missing out on that clinical expertise during development.
Big time. A huge missed opportunity.
Okay, so we have these gaps. The theory-practice gap, The narrow focus on bias factors, neglecting individual fairness, lack of clinician input. What do we do about it? How do we bridge that divide?
Well, first and foremost, collaboration. We urgently need the tech folks and the clinical experts working together much, much more closely right from the start.
Makes sense. What else?
Data, data, data. We need better data. More diverse, more representative, specific to the medical field. And that includes improving the devices themselves, like pulse oximeters, making sure they give equally accurate blood oxygen readings for people with different skin tones. The data source matters.
Right. And thinking beyond those standard bias categories you mentioned.
Absolutely. We need to talk about all the things that can cause bias, not just race or gender, and use clear terms like, are we talking about biological sex or social gender? It matters.
And prioritize that individual fairness.
Yes. Develop ways to measure bias at the individual level. Create tools that help doctors make personalized recommendations considering all those unique variations between patients.
It sounds like moving beyond just tweaking the algorithm. It's about the whole clinical context.
That's the key. Integrate AI fairness thinking into the entire process. Get clinicians involved early and continuously. Develop ways to measure if the process itself is fair. They call it procedural fairness.
So even if the algorithm isn't perfect, the whole system around it aims for equity.
Precisely. Including having non-AI backup plans or alternative clinical pathways to ensure fair outcomes. It's a holistic approach.
So wrapping up, it's clear that getting AI fairness right in healthcare isn't just about better code. It's much deeper.
It really is. It requires understanding the context, the data, the clinical workflow, and ultimately the human impact. Collaboration is key.
Which leaves a big question for all of us, doesn't it? As patients, as people interacting with the healthcare system.
Yeah, what does it mean for you when an AI might be involved in your care, potentially using data that doesn't fully represent everyone?
How do we push for systems, collectively, that are truly fair and serve all of us equitably? Something to think about.
Definitely something to think about.